It's been pretty wild, actually. You think of something, when we used to have really um, terrible, terrible side effects that people who were transplanted, who got bone marrow transplants and things like that. Oh my gosh, they used to get something called graft versus host disease, where their transplant would react to a part of it would kind of attack their skin kind of by accident, or a kidney transplant would reject the body, or um, just these really terrible rejection and uh, graft uh, graft versus host. Even the chemotherapies, just terrible, terrible mucositis, and people would just get, the radiation would be, they'd get total body radiation, and they'd get like really bad sunburn kind of types of things. So it was pretty brutal. And um, now with so many, when I was talking about the whole idea of that hippo with the birds and just attacking the birds, one of the advantages of doing something like that is that you do hopefully have a lot fewer side effects when you're targeting just one specific um, piece. Um, you can really have some people can be on immunotherapies and really not notice a ton of anything. And so that's really different. Um, and great. And I just think it's gotten so much better. I mean, even we're doing autologous uh, stem cell um, CAR Ts, different things like that in the outpatient setting now. You can actually get that done at the infusion center, at the clinic. I mean, the what's really exciting is the idea of being able to bring these types of innovation to rural communities, and to even places that are an hour or two away. I mean, if somebody could go to Maple Grove and get some of like a CAR T, I mean, can you imagine? That would be really pretty incredible. And so it's really opened up um, this whole scope of possibilities. But I do know that um, on the other hand, we're seeing cancers that are affecting people younger and younger. Um, People with colorectal cancer who are 31 years old and things like that. That, I have to say, has been a real downside, something that I have really struggled with a little more, seeing these such young people that are affected. Um, on that CRISPR study, I think my oldest patient was 62. Almost all of them were between, 40, 50 years old. So it was just a really scary thing to have to think about. And what I think about when I say that is just your stages of grieving, um, the way that you handle that kind of news when you're 30 as opposed to 65, 70, 75, 80 is very different. And it takes a whole different level of care. It takes a whole different mindset. Um, so I I do think that's a big deal too.